Hi everyone, this is Dr. Jaslyn from DentistChannel.Online. Here with us we have Professor Dr. Johnson Raja James. Sir, would you like to introduce yourself?
Hi Grayson. Okay, pleasure to be here, and I'm Professor Dr. Johnson James. I'm Professor of Periodontics. I teach in Raja Central College as the HOD and Vice Principal, and I'm also the CEO of Implantree International Dental Hospitals, which has presence in India, Dubai, and Maldives, and also President of the Implantree Global Foundation, which is into teaching advanced implantology, offering MS programs. And so basically I'm a teacher. I like to teach and teach what I've learned, and that is why I'm here, not just because we do advanced implants, because I have been involved in multiple training programs and teaching and students and alumni all over. So that's why I'm here.
That's amazing, sir. Sir, can you throw some light upon zygomatic implants?
Yeah. So my life began as a consultant, and I realized that as a consultant you should be able to do any case that comes across your way. When you want to be recognized as a senior consultant in implants, you cannot say this case I cannot do. So I realized that to manage any kind of case that comes across to you, you need to have zygomatic implants in your armamentarium. But at the same time, you cannot demand that I will do it only for these patients, I'll do it under GA. So when I got to know about the extra maxillary technique, the extra sinus protocols, where we can do zygomatic implants under local anesthesia, that gave me enormous confidence, and it made me very close to all my consultants. Now, call Dr. Johnson, he'll finish his case. So that's what has really helped me out.
So when did you start with zygomatic implants?
It was way back in 2013. Those days, now we ourselves offer live surgery workshops, we give mentor guided hands-on, but in those days it was not like that. There were just I attended a symposium organized by Noris Medical in Goa, where we did models, and then they showed us on the video how it's all done. But we didn't see any live surgeries, and YouTube was not with so many zygomatic cases as it is now. And then we came back, and luckily I had my first case in the next week itself. A friend of mine from the church, and an ideal case zygomatic, and that was my first case in 2013. And from then it is not turning back. We now are a center for referral for zygomatic implants. I consult all over India. Now in our Dubai office also we have started zygomatic implants, and with that USP, that niche market you are tapping into, it's been amazing.
So, if in today's world, if somebody has to start with zygomatic implants, how would they do so?
There are two ways at it. One, you go in blindly and get stuck, and the other, you go through literature, you read books, you attend live surgery workshops, you go for mentor guided workshops, you do cadaver workshops, and see all those YouTube videos that is there, and get trained properly. Go for training again. I met one doctor yesterday as I was coming from the airport here in the US. He told me he has attended 5 workshops and then he started doing. So it is not a cakewalk thing. Zygomatic implant has its risks, and it needs extreme surgical expertise and common sense to go ahead. So it is best there are 3 levels. First, you go for a model training, and then you go for your cadaver training, and then you go for live surgery workshops, and if possible workshops which offer you mentor guided placement, not once. Do it 2-3 times, get confidence, and then you go for your first case, and then it helps.
Yes. So, how do you assess if a patient is suitable for zygomatic implants?
So, I'm not going to the technical part of it about Bedrosian classification, all that stuff, but then moment I see an OPG, orthopantogram, a 2D X-ray, and I see that there is no bone behind the canine. Up to canine there is bone, and behind that you have a huge sinus pneumatization or something like that. Those cases are indicated for zygomatic implants if you want to go for fixed options. So that is on the 2D, and then once we do that, then we go for further evaluation using a cone beam CT or a CT facial, radiographically. Of course, then you have prosthetic evaluation. Systemically, the patient should be healthy and all those stuff. But basically, we see that there is deficient bone, a deficient maxilla, the upper jaw, and deficient posterior maxilla, and we go for the zygomatic. Of course, other indication now, especially in this COVID pandemic, we had the second pandemic, a lot of mucormycosis cases, maxillectomy defects, tumor cases. All these cases have been rehabilitated with zygomatic implants. A good option for restoring smile, restoring function, restoring speech. Amazing system.
Yes, sir. So, what are the challenges that you face, and how do you have any strategies that you deal with them?
So, even for like I came for this interview, we do some planning, right?
Yes.
You're here, you have planned some questions.
Yes.
I have planned some answers for simple thing. You know, going for coffee, I see if it's hot or not. Then equipment. So, planning is something that it is mandatory for anything we do, right? And like so, zygomatic requires a lot of planning, and you need a good team trained. It's not like you are the only surgeon in the room. Okay, your assistant should know next what instrument sir will ask. I do not change my eyes. I have to keep my eyes in the operatory, in the patient's mouth. The trajectory is so important. I have to see which angulation is going. So I keep my eyes over there, and I just move my hand over here. My assistants give me the next drill, and so you need a good team, right from explaining to the patient to getting them onto your trust curve, and also in the theater operating case, and also post-op follow-up. Team is very important. And the team includes, I have an oral medicine specialist who helps me in planning everything, the cases. I have people who give me the guides. Armamentarium has to be perfect. Okay, so it's a big thing. But the actual procedure by itself, if all is well, takes only 15 minutes. If you do a proper zygomatic implant, single zygoma is 15 minutes. A full arch rehab will take you, if everything goes well, by grace of God, it will take you 1 hour max. So it's a very well doable procedure under local anesthesia.
Sir, since you're dealing with these kind of implants, how do you communicate with the patient and their realistic expectations?
So, two kinds of patients. One who come to you asking for zygomatic, it's very easy. So they are mentally prepared. They would have seen videos on YouTube. They would have been scared by their friends, relatives, other dentists, and then they overcome all the fear, and then they come to you, and it's straightforward. It's just the costing that works. But then there are cases where we diagnose, more number of cases we diagnose and see the bone is deficient. But see, not to boast or not to feel proud about it, I see zygomatic as another implant. Your mind should be clear of the clutter that it is something great we are doing. It's a big implant and it's a huge surgery. Once you get over that fear, once you go over that hurdle of expertise, it's another system. So I have a patient walking into my practice right now, and they're okay. Morning 10 o'clock, like, I'll do it at 12 o'clock if I have the armamentarium. It's not like I'm going to sit in my home, pray the whole day, become mentally prepared for the case. It's not like that. So when you have that confidence, that rubs on to the patient. If I'm not confident, if I'm telling the patient, there is one procedure zygomatic, it's little tricky, it is little complicated, it might go into your eye, they won't take it up. So, but you have to be confident first. Not only zygomatic, any implants, even do a single implant, no, you're going to tell the patient, I'm going to do a procedure for you, I'm going to drill into your bone, it might go here. You don't say all that, no, but then you have to give them complete information, you have to get their consent, and then proceed. So for me, getting across to zygomatic implants has not been very difficult till now, hopefully.
So, what are the 5 tips that you would like to give us as young budding dentists?
To dentist? Oh, I thought about zygomatic implantologists. Okay, so I am very clear about one thing to my team and to everyone I say is you have to be ethical. Being ethical is, you might be pushed by a marketing team, you might be pushed by a referral dentist, but then do not do anything that is beyond ethics. Charges are different. You might charge less for a patient, you might charge more for a patient, but then you do a treatment plan which is ethical. Like you save teeth which have to be saved. Just for sake of doing a full mouth rehab, don't extract teeth. Delay implants as much as can, right? And be ethical in your practice. And if you want to invest in something, you invest in yourself. Learning is something very. So this conference, the World Implant Expo, has been amazing. Every lecture I have learned something new. After all these years of doing implants, every lecture has given me a take-home message. I should thank Dr. Shankar sir, Dr. Mahesh Verma sir, and your team has been amazing right from start, promoting, telling things, and learning is paramount. You don't stop learning. People come and tell me, oh, you're done, but still, there are things I lack. everyone lacks, and I can learn something from you also. It's not like no, you learn everything from a lot of people. Keep your mind open, and there is always something new to learn. So be ethical and be continuous in learning. Pray well. Okay, I am a solid believer in praying and starting your, even in the lecture I told, so before I do any FMR cases or even difficult cases, I make a loud prayer, not a mental prayer. I pray loudly. I tell, I seek help. You know, otherwise it's not going to work out. You have, it's so whatever we have learned, we do, it's divine healing.
Yes,
that's
God
going
is
to
our support.
that's you have to realize that, you know.
Yes.
You take it out of your head that I have done a great surgery. It's no, it's your team, hands, prayer. That's what helps. So you pray well, and I think this will work. And of course, respecting your mentors, you need a good mentor. It's very important that you have a good mentor you can look up to. I still have cases. I have my students, my not my college students as such, but my program students who are stuck in a case. They call, sir, this is happening, what do I do? And we give them solutions, and then they call back and tell, sir, thank you so much. You know, it feels good. So you have a mentor. We got 4, huh? Last one. Money is not everything. So I think and money is not everything. So, yeah, so I feel this is what has been important for me, because no, if you're going to make your plans by keeping money behind your head, you're going to go wrong. So be ethical, pray well, mentors. What did I say? And all this, I think you got it across. I think I've given you 5 points.
Thank you, sir. Thank you for your valuable time.
Thank you so much, Gracelyn. Thank you, guys. Thank you, DentistChannel.Online. Thank you, Team World Implant Expo, for this amazing experience, and looking forward to be with you again soon.